Can you afford to live with a critical illness? Be covered with Momentum. 6 years ago, their happy plans for retirement changed for Frank and Heila Hunt when Heila was diagnosed with Alzheimer's, and the family faced the prospect of Heila's coming mental and physical decline.
You don't understand this thing until you're actually faced with it and you're living with it 24 hours a day. There's some very serious challenges there. Yeah, well, she was only 56 at the time. We'd already been exposed to Alzheimer's, and that her mother had Alzheimer's and actually stayed in the house with us for a little while. I think, you know, in her case, the normal situation where the forgetfulness comes in. But with her, very early on, she also started finding it difficult to speak, and also, you know, repeating herself, telling the same story over and over again. So yeah, that's really what prompted us to go and see Dr. Lipschitz.
So Alzheimer's is a progressive disease. So we have, for example, a protein called amyloid protein, which is present in everybody. For some reason in Alzheimer's disease, the protein gets broken down into tiny fragments and gets then deposited in the brain. It's as if somebody's punched the brain and there's inflammation around it. And that inflammation together with the protein then damages and destroys the brain. As the disease progresses, the patient will lose mental capacity. At some stage of the disease, usually relatively earlier, you get a variety of behavioral problems. And that is the single most difficult part of the management of this disease. Alzheimer's disease is a disease of families. It's not a disease of patients because of the effect the disease has on the important others.
Frank looked after Heila at home for 4 years, but eventually had to move her to a frail care home when the effects of her progressive disease became too difficult for Frank to cope with.
There we go.
She lives in a home called Abbey Cross, which is just 10 minutes away from now. So again, I'm very fortunate in that I go there every day. I think in the last 2 years that she's been there. Things like, for example, dressing. She would put her clothes on inside out. She'd put the shoes onto the wrong feet. Little things like helping her to change the channel on the television. If the cell phone rang, I had to press the button for her so that she can talk on the cell phone and that sort of thing. So really a 24-hour job. Like a lot of Alzheimer's patients do, she went through a pretty aggressive phase as well. Like most of them do, the aggression was directed at me because I'm the person who's there. We've had an excellent relationship for 40 years. We've been absolute soulmates. And then with this thing came along, very difficult to accept. But again, I say it's not her, it's the disease. We took a knock as far as money's concerned, in that she obviously had to stop working, so her salary went out the window. I took the decision to retire early, so I retired at the age of 58. And what we wanted to do was to spend as much quality time together in the time that we had left. The outside world gets further and further removed from you. You need to have what I call me time. You absolutely need that time. And I was guilty of not taking enough of that time at one stage.
Yeah, no, it's just seeing someone disappear, you know what I mean, yeah. And although she's there, you know, I mean, she's not the person she used to be in the past, yeah. I think it's probably the toughest, yeah. The way I support him is just to be around and you know, just sometimes just to be a lending ear so he can talk about things, yeah. That's what. So nothing special, really.
Whatever positive you can get is a golden moment. If you get a kiss, if you get a smile, if you get a hug, or whatever the case might be, or you can see that she's smiling at something, that is a golden moment. And that is what I concentrate on continually. In the daytime now, I'm okay because I'm very busy, so things are not that bad. The problem comes at night. When you get into the house, I'm alone with the 2 little dogs over here, and then, then it's not easy. But luckily, you know, now with Heila being at Abbey Cross, I'm following a passion of mine, running. I see myself as one of the lucky ones. But I just picture, say for example, an 80-year-old couple, the one gets Alzheimer's, they don't have the means. This poor person is stuck with this disease, and this kind of things I've explained to you now. It's devastating, it's absolutely devastating. So what we've done is we've put together a relay race where I've got 20 people, and we're going to run down to Durban. Yeah. The purpose of this is to raise money in order to assist and train carers of Alzheimer's patients. I'm doing it for her, and I think when we end, what's going to happen is we're going to run into the sea on Durban's beachfront, and I think that's going to be a very special moment. Oh, I miss my wife. I mean, I'd say that she was my soulmate for 40 years, she's still there, but she's not there.
Can you afford to live with a critical illness? Be covered with Momentum.